So body mechanics is the way we move our body during our daily lives. So movement. So movement of our body that we use in our daily lives. So how do we move? We sit, we sleep, we carry, we lift, we bend, and what else? There is one. Lift, carry, stand. Okay? So, in body mechanics, we are going to observe body mechanics in all procedures that we do, especially bed making, especially when we do our lifting. So, we observe our body mechanics. So, in our body mechanics, why do we observe our body mechanics, or why do we have that body? Okay, so why do we do it? Why do we observe? Why we perform body mechanics? So one is to keep what? When you answer, you better raise your hand. Okay? So why do we use, or why do we observe body mechanics? To prevent. Okay? To prevent back injury, back trauma, or any back problem. Okay? So, for the healthcare providers, mostly the nurses, so they are having, mostly of them are with having back pains, back injury. That's why after how long, for how many years, working in a healthcare, working with a patient care, without observing body mechanics, at the end of the day, they will develop this what? Herniation of the lumbar, or lumbar problem, back. Do you know where is your back? So how many bones do you have in your back? So what are those back bones that we have? What? Because I said the lumbar.
Because I have L5S1 herniation.
L5S1. What is S1? Whole back is called spinal. And it depends whether it comes from the cervical, 1 to 12 or 1 to 7? Okay? And it is the thoracic, lumbar, the caudal, and the coccyx. So we have the cervical, if I'm not correct, if I'm not mistaken, it is 12 or C6 or 7. There are 7 cervical, there are thoracic, I don't know how many. Then lumbar 6, coccyx 4, and 1 something. So it will be like this. Okay? You have to do this to show it to me how you are going to prepare for plan to lift. Okay? Using your leg muscles, using your abdominal muscles to lift and carry the patient. Number 1, plan for lift. How do you plan for lift?
Doing like this.
Like this, huh?
Yes.
Okay? So you have to tiptoe a little bit. Okay? Because these are the techniques when you are going to carry your patient. Okay? Plan to lift. Second,
Ask for help.
ask for help before you lift a patient. If you will not be able to lift alone, you need to ask for help.
Ask for help.
Okay? Ask for help is as if you are going to lift a heavy patient and you will ask for help. Okay? If only if you will not able to carry the patient alone. Next.
Widen your base of
Widen your
support.
base of support. All of this, we will be doing it when we lift and transfer a patient. That's why I'm asking you now how to plan your lift, then ask for help. Number 3, widen your base of support. Widen means widen. You cannot lift a patient with both legs together. Okay? That's why you need to widen the base of support. Okay? Next.
Bend your knees.
Bend your knees. Okay? One by one, I will ask you to do it. Bend your knees. Next.
Tighten your stomach
Tighten
muscles.
your abdominal muscle. Means to say, when you are lifting a patient, you need to tighten the abdominal muscle. Next.
Lift with your leg muscles.
Lift with your leg muscles. Lift with your leg muscles. Next.
Keep your load close.
So, load close to you. We cannot carry the load with like this. You need to close. Okay? Next.
Keep your back straight.
So, keep your back always straight. Whenever we do bed making, whenever we lift patient, we should not do like this. Okay? Always observe your body mechanics. Last one. And keep your back straight. So, always keep your back straight. Never bend. Never what? Never bend. So, how, right?
Yes.
And one of the body mechanics principle is never bend.
Yeah.
Okay? Push rather than pull. So those are the principles. Okay? So you will remember all those principles whenever we perform something, whenever we perform procedure. Like bed making and now the body mechanics, transferring and lifting. Sliding board or the sliding sheet. Number 2. Number 2, walkers. Walkers. 3. Number 3. What is this? Grab bar. Number 4.
Gate belt.
So we have the transfer gate belt. Number 5. Trapeze bars. 6. Hoyer lift. 7. Still nobody.
Oyer lift, ma'am? Ano pangalan?
Hoyer.
Oyer.
7. Mechanical lift. 9. Wheelchair. 10. So maybe you know the number 10. Patient stretcher or patient trolley. So okay, let's go to the types of techniques. Transferring techniques. What are the types of transferring techniques? So what are the techniques you will be using when you transfer patient?
Stand pivot transfer. Ito ba yun?
Okay, we have the stand pivot
Pivot
transfer. 2 is the bent pivot. 3 is sliding board transfer, and the last one is one man
Dependent transfer.
So when we transfer, we have some principles or the mechanics of body transfer. Body mechanics, the transfer. Number 1, what we require is the proper alignment, body alignment. Number 2, lifting. What else? There are 4. Okay. So the safe use of body mechanics. Okay. The safe use of the body using the correct posture, body alignment, balance, and what is this? Balance and bodily movement. So we have four to carry a patient, to lift and carry a patient. So we have to practice the safe body mechanics. So we need the correct posture, the body alignment, the balance, bodily movements, and the balance. Okay? So you cannot lift a patient if you are imbalanced. So without the correct posture, you cannot lift a patient even. Okay? So now, together with this, we have patient's positions in bed. There are around 11 positions of patients in bed. So what are those positions?
Supine position, prone position, left lateral position, right lateral position, hinge position, polar position, semi-polar position, pendulum verge position, reverse pendulum verge, mid-chest position, dichotomy position, and erect or standing position. And stand or erect position.
Okay. So do you know how you can position your patient in those 12?
11.
Huh? Do you know how to position your patients in bed? And why do you need them? Why are you going to position your patients in such position? Okay. So what, for example, the procedure that you require such position? What procedure you require, why we will put the patient in that position? If the doctor asks you to put the patient in supine, so what is the description of supine?
When you are coming to do tracheostomy, you need to put the patient on supine position, facing up, so that you can do the procedure smoothly.
Tracheostomy. Okay, what else?
Nasogastric, also tube feeding.
Nasogastric tube in a supine position.
And then semi-forearm position, 30 degrees semi.
Huh? How many degrees?
30 degrees to 40.
Okay, what else?
And when you want to do constipation, also it's lateral because of where the intestines you can locate it. So as you are doing rectal, you go through the rectal.
So, parang meron pa yata ako kahapon dito. Which side in the lateral?
Left lateral position.
Left lateral position. Okay, what else?
Somebody should also sit.
You are the only one who studied level 2? Sorry, there are 11 common positions of patient in bed. 1. Supine position is when the patient is facing up. Hands are on the side, legs straight, and the toes are facing up. So these are good for abdominal surgery. Okay, next we have prone position. Prone position is facing down. Facing down, hands up like this. Okay? The chin to the left or to the other side. And the legs, abdomen flat, legs down, toes down on the ground. Next, we have
Lateral, right and left position.
lateral, left and right. So, how do you position patient in the left lateral? Okay. So, whenever you turn a patient, you have to scoop the shoulder, scoop the knee, and gently turn to the left or to the right, one leg straight, other leg bended over the knee. This is the left or the right lateral. And left, it is used on all patients with during the procedure of rectal procedure, rectal exam, and rectal taking of temperature. Okay? Why on the left?
Because the large intestine
Okay. So because of the position of the small intestine is directed towards the rectum. Okay, next is Sims position. When we say lateral, patient is on lateral, straight back. On a Sims, it will be halfway drooping. Okay? Both legs bended separately. Okay? Hands either on the chest or on the side. One hand only like this. Okay? And the other hand, it could be up here like this. Okay? Sims position is used for patient. Where are we using the Sims position?
Recovering position.
Huh?
Recovering position.
Recovery position. So why do we place patient in recovery? Why do you place like in recovery? Okay, so to keep the airways open and this prevent the tongue of those unconscious. Sims position is for those unconscious patients or recovery patients because to prevent the tongue from falling back. Okay? Unconscious. Sims, unconscious, prevent the tongue from falling back. So either it might be left or to the right. Okay, next we have the Trendelenburg position. Trendelenburg position is also known as what? What position?
Forgiving bed.
Huh? What?